Hi, Althea Kaminsky here for the Learning Scientists. In this office hours video, I want to talk about note taking. So I work a lot with medical students, specifically first and second year students a lot at this point. And there are a few specific challenges to medical school that I think make note taking a really interesting. So one of those challenges first is the sheer amount of information that students have to learn and take in. The fire hose of information that happens in those first few years. Fortunately, I guess this is a problem that's not going to go away. We live in a time when our medical knowledge is constantly progressing and advancing. We have new technologies that are happening, right? And so every single year, there's just more to learn in order to be considered a newly trained doctor, right? Who is relevant to understand the latest and greatest of medical knowledge, right? So there's just a vast amounts of information that has to be taken in. So when we think about what note taking needs to achieve in that setting, one of the things is condensing large amounts of information into smaller, more manageable chunks. The next challenge is that medical students, while incredibly smart and talented, that's how they got here, are still relative novices in the area of medical science, medical education, right? So we not only do we have a large amount of information, but we have novices trying to understand it, which means, right, when you're new to an area, when you're a novice, it's really difficult to pick out, okay, yes, this is a lot of information, and here's what is most directly relevant for me, or the idea that is central here, versus, well, this is useful to know, or maybe helps clarify something, but it's not central to what I need to know, understand, right? They have a lot of difficulty parsing that out. In other words, and what medical students like to call that is like a high yield. What's the high yield information, right? The information that will get me the most in terms of my learning and understanding. And so not only do your notes need to condense a large amount of information down, they really need to be taken in a way or formatted in a way that helps develop understanding and meaning, right? That helps transition somebody from a novice to an expert, from somebody who just feels like it's a bunch of random facts flying at them, to somebody who has a well-developed and integrated knowledge structure to understand and start to make those distinctions, right? Oh, this is really important and central, and this is useful, helpful, but not key, right? Or useful in this context and not that context, right? So our notes need to help us develop that understanding, right? To put meaning onto a lot of facts. A third challenge is organizing information, structuring it in a way to help long-term retention, right? Because we're not just studying and learning facts because it's fun and interesting, right? I read nonfiction books, right? And there are things where I think, oh, that's really cool and interesting. This has helped my understanding. But I don't have to know this, right? I don't have to know this information and use it later on in my career. I might, but it's not central, right? Versus medical school, you're learning a lot of information, it's all new, or a lot of it's very new, and you have to not only understand it, right? But then also use it later. There are a lot of tests that come up. Eventually, right down the line, the reason why we're learning all of this knowledge and information is to be able to apply it in clinical practice, right? To be a better doctor, to treat patients. So, in order to acquire that knowledge, we don't just want to acquire it, we want to have the best long term learning, right? So, we want to have notes that help us develop long term retention, right? So, probably formatting them in ways that makes it easier to do retrieval practice or space practice, right? So, we need to facilitate durable long term memory with note taking. Another goal, a final goal, right, is that all of this stuff is happening. You have a large amounts of information. You need to develop understanding. You need to remember it later. And you have to do all of that in 4 years about, right? Or the first few years of medical school when students are in classes and taking a lot of notes. That, of course, continues because there's still tests, there's still knowledge. But a lot of the sort of foundational knowledge has to be understood in like a year and a half, 2 years, right? It's not a lot of time. So, unfortunately, like everything we mentioned, the first three goals is happening against a clock, right? So this is an all-out sprint to the end, which means that time management is absolutely crucial. So it would be nice, maybe an added bonus, if notes are taken in a way that helps us track our understanding and our learning progress, right? So that we can be the most efficient with our time and make good study choices. That's a lot to ask of notes, right? So I just laid out four challenges and so four kind of goals of note taking, right? That we're condensing large amounts of information, we are developing understanding, we are facilitating long-term retention, and we are organizing so that we can track our progress, right? And hopefully improve metacognition in some way, which is a lot. But, right, one of the things I want to talk about in this video, trust me, I'm sure I'll write a blog post later to talk in detail about different strategies for how to achieve those different goals, or a few different approaches that we might use. But what I think is really interesting is thinking about note-taking in that way is maybe really different from how people typically think about note-taking. So what your notes are not doing, what your notes should not be doing, especially in this setting, they should not just be verbatim records of videos or chapters or lectures that you've seen, right? You shouldn't just be copying things down from a PowerPoint. There are a few different reasons for this. One, that takes a lot of time. And as we just talked about, time is not your friend, typically, in medical school especially. And two, we have to really think about what are our goals here, right? Now, there are cases where sometimes your goal is to provide a record of what you've attended or seen, right? Maybe you are going to a live lecture and you have no access to this material outside of it, right? There's a guest speaker coming in, right? And you're like, oh, I don't know if there's going to be recording this later, right? Like all I have is me here in the moment trying to take records so that I can reference them later, right? In which case, yes, maybe there are some verbatim records you need to take. That's not typically the case when we're studying in an educational setting, certainly not today when we have usually PowerPoints that are available. There were recordings that you can watch later, especially if you're going to read from a book, you have that book there. Because a lot of people, I think, have, or some people at least, have the mistaken assumption that by writing it down, by the act of moving your hand across the paper, moving your fingers across keys on a keyboard, right, that sort of physical process is what causes learning and memory, and that's not what's causing learning and memory. If all you're doing is just trying to have a verbatim record. So you have to ask, if you find yourself writing out lots and lots of pages and pages and paragraphs of notes, what are we doing? What is the purpose here? Am I trying to create a record? And if there's already a record that exists, why do I need to do this, right? Because that's not going to necessarily aid in long-term retention. However, when we are taking notes where we have to make decisions about what we're going to write down, right, that this is important and not that, or that this is important for my understanding, right, the way that I understand this, that if you are going to paraphrase something, put it into your own words, right, so you read through something and go, oh, okay, I think it's kind of like this, let me write out that analogy. Or if you're reading through it and you're saying, I have some questions and I'm not sure if I understand, right? Maybe make a note of something, right? Anytime that you're having to do some active decision making, right, where you are choosing what you write down, that is going to lead to more effective note taking, right? Because now we are, I hate the term actively engaged, because the activity is in your mind, and that's something that's difficult to really see and monitor, and so it's difficult to assess really whether or not that's happened. But again, the important part here is some sort of decision-making process. Having some sort of structure to your notes, right, is better than no structure, because then you have to make choices, right, about what's important. You're trying to be restrictive. So what notes are not is some verbatim record of what has happened, right, typically, right, because if you have that record, you don't have to write it out. And again, this is kind of different because lots of people view notes as a record, and they can be, but in a lot of learning contexts, that's not what's important. And I did mention, it's one of my goals of note-taking was to provide some sort of record, but here I'm using that in the sense that your note should be a living document that updates with your new understanding, right? So you might rewrite out your notes, but only because you're like, hey, I've got like 80% of this information down, and I want to format the 20% that I need to know a little bit differently so I can practice with it more. Okay, yes, we're kind of writing out a portion of our notes, but we're being strategic, we're being thoughtful about it, and it's not a verbatim transcription. It's saying, I'm going to take out these chunks because this is what I need more practice on, right? I'm going to focus on that. And hopefully, if we're learning in sort of a cyclical, iterative process, then that little bit is getting smaller and smaller and smaller as our kind of greater understanding develops, and we need sort of less support to understand those little small bits because we're really, really titrating down, really focusing down on like key pieces of information or things that were specifically difficult for you and something that you just need some more practice with, right? So viewing notes as a sort of active, living document of understanding, of learning, I get the impression this is really different than how most people think of their notes, just based on interactions with students and conversation with other people, right? That I see a lot of people trying to just take sheets and sheets of notes, or it's on, a computer screen type, whether it's being handwritten or typed out, that the format doesn't really matter. And in fact, when I talk with a lot of students, we'll talk about whether they want to take notes by hand or on their laptop. And what I tell them is whatever system really works best for them. There are a lot of advantages to taking notes on a laptop and typing it out, being that there's lots of cool tools that you can use, lots of programs that are useful. But if you're not familiar with those, it may take you more time to learn those than is maybe really worth it for you, right? Versus if you have a good system of taking notes by hand, that's something that you are comfortable with, that you enjoy doing, then keep doing it. There's nothing wrong with that. As somebody who keeps multiple online calendars as well as a bullet journal, I still feel like I like having it written out. I like having something that I can check off, and I just don't feel the same thing, right, when I use a computer. And that's fine, right? Because the medium doesn't really matter so much as the process, right? And especially when I'm dealing with medical students and they only have so much time, like we don't have to waste time learning a computer program if that's not going to pay off for you. So there are pros and cons of pen and paper and to writing and to like online and computerized things, that it doesn't really matter which one, as long as it doesn't matter which one you do, as long as it's the right one for you, right? But again, this only makes sense in the context of thinking about notes in terms of what your goals are, right? So while a lot of things I've talked about here have been about medical school, because that's sort of the context I'm working in right now, I think this advice applies more broadly, that when you find yourself taking notes to learn material, you have to ask yourself, what are my goals here, right? What are my constraints? What are the things I'm doing? When I read books, right? I clearly love books. I have a lot of books behind me. Most of those are fiction. I will highlight and make notes, but what I'm highlighting and making notes about is very different than when I'm reading a book about memory, or I'm reading something for work. And I've been reading a lot of like history of psychology books lately, right? And I will be taking notes differently for those things because I'm reading them for different purposes, right? When I'm reading something just for my own sort of casual enjoyment, I might write down a phrase that I like, or there's just usually it's something I like the way it sounds. There's something particular about the wording of something, the phrasing of something that I like, and I want to note it. When I'm reading something more academic for work, then I'm writing something down because I need to look it up later. I need to integrate it into my own practice in some way, or I need to look up more information. So I am interacting with that information and taking notes about it, right? Very different goals and purposes. I might take notes on something because I will be giving a presentation about it, in which case I want to be able to remember it, right? That I can't, when I'm talking with people sort of in this format, I want to be able to just have that information fresh, right? That I can just say it naturally. And so I'll be taking notes and studying that in a very different way, right? So again, when we think about notes, it's really in note-taking and effective note-taking, it really matters what your goals are, and then you can kind of interact with the text differently. So I hope this was useful in kind of thinking about note-taking. Like I said, I am sure that I will be writing more blog posts about this and giving more specific advice with citations and everything. But I've been thinking a lot about note taking, so I wanted to share that for my office hours video.